So I was always told that, Medicare does not cover any healthcare costs overseas. But I had a new agent, and she told me that they do cover costs overseas under certain requirements. So I got a little lucky that way. I got a check completely reimbursed 30 days later.
So today's guest, Todd, an American, will share his story about a medical event he suffered while living overseas and how he got reimbursed for his medical care even after his insurance claim was denied. And so I'm delighted to have Todd. Todd, welcome to the channel. Welcome to Vagabond Awake. I'm happy to have you here so you can help other people avoid what happened to you.
Thank you, Dan. Yeah, I'm Todd. I live in Chicago, Illinois. I had a heart attack back in September in Thailand. I went to and for like 4 days and then realized I had a heart attack.
When this interview with Todd is over, I'll go through a list of takeaways that I have.
I went to the emergency room and I was taken very good care of while I was in Thailand. I had better care in Thailand at their hospital than what I had here in the United States. In fact, when I flew back to the United States after being in the hospital for about 4 days, I had to check myself into a hospital here in the United States, and I realized they kind of messed me up a little bit. But I went back on the medication that they gave me in Thailand, and all my problems cleared up. So when it comes to the medical stuff in Thailand, it's very excellent care. Now, while I was in Thailand, well, before I left to go on my trip, I got some international health insurance. So I guess one of my biggest problems was that maybe I didn't read the fine print when I signed up for the policy, because I thought that any pre-existing condition you had to be 2 years in the past. But when I try to use my health insurance, they told me it had to be 5 years in the past. And pretty much any type of pre-existing condition you have is related to anything else. So if you have diabetes, that's related to can be related to having a heart attack. If you had cancer, that can be related to a heart attack, and heart attacks can be related to diabetes. So I had diabetes at the time and had a heart attack. But before I left to Thailand, I went to my doctors, had everything checked out, so I had no heart problem. But I did have diabetes. And because of that, it was a pre-existing condition. They said it wasn't covered because that could have caused a heart attack or contribute to a heart attack. Now, the interesting part about it is I no longer have diabetes, but I do have a heart condition. So being in Asia was great for my health when it comes to terms of getting rid of my diabetes. But the air quality was bad for my heart. But other than that, if you have pretty much any pre-existing condition, they can always deny you coverage because everything is related to everything else.
So people worry about when they go overseas and they go to a hospital, how is that whole thing different? So I'm wondering, you hear stories about some countries are different than others. So when you arrived at the hospital for treatment in Thailand, did they require a deposit from you first before they would treat you, or how did that part of it go?
I got you. Okay, when I first got there, I went to the emergency room. They asked me if I had insurance or the ability to pay. And I pulled out my credit card and my insurance card and gave it to them. And I think the deposit was like $300.
Okay.
Or maybe around that much, maybe even $3,000. I really didn't know because I was pretty much out of it. But I was still had the mindset to be able to go into my wallet and get my insurance card and at the same time get my credit card, and I gave it to them. So I thought that would cover most of my expenses. Then the next day, after they treated me and they put in a stent, the next morning they came in and asked for payment because most hospitals in Thailand are privately run. So they kept pushing and pushing and pushing. And during this time, I was still in emergency care, and I could barely even walk or even go to the bathroom. I was in really bad shape. So I feel kind of like they kind of took a little bit of advantage of me of my condition because I could barely function. They kept asking for the insurance. They said my insurance won't pay for it, or else I have to make a claim. So I had to call up my insurance company myself from the hospital, and they wouldn't do it. And after the second or third day of talking to my insurance company, I found out that my claim would not be covered because she asked me questions over the phone, and I told them I had diabetes and I had a heart attack, and she said that they probably would not cover the cost. The administrative part of the hospital kept coming in every morning and every afternoon, kept asking for payment. So I did give them my credit card, and they took around $10,000 off of my credit card for my hospital stay. My total cost for my hospital stay was $47,000.
47,000.
For
And how
47,000.
long were you how long were you in the hospital?
I was in the emergency room for 3 days and in the private room for 1 day. So the 47,000 covered my stint that or the medical treatment or like an operation and 4 days in the hospital.
Any idea what that would cost in the US? I mean, was that a fair price or was it
Well, now I think in the US, from what I've been reading, it can cost anywhere between $100,000 to $700,000.
100 to 700,000?
Yes, yes.
Wow. So the stint, that's like something they put inside the vein to open it up? Is that
Yes,
what?
yes. They go up your arm all the way through, all the way to your heart, and put in a little, I guess, tube, a mesh tube, and opens it up. And it takes about 2 hours.
Wow, that's sounds amazing. And that price, I guess, is fair compared to America,
Yeah,
it sounds like.
yeah, very cheap compared to America.
So the US used to have a system where insurance companies were allowed to deny claims based on pre-existing conditions. And now I'm just a layman when it has to do insurance, health insurance. But as I understand it, under the Affordable Care Act, which I think was passed, I don't know, 2012, 2010, something like that, insurance companies were no longer allowed to deny pre-existing conditions. Does this mean in the general sense that the ACA concept of not being able to deny coverage, that doesn't necessarily apply to companies outside the US that are insuring
Correct,
people?
correct. The ACA only applies to the United States and our territories.
Right.
Before the ACA, California had a law to where they would not be able to deny you based upon a pre-existing condition. And I think also Hawaii, or pretty much every other state, had the law to where they can deny you based upon a pre-existing condition. But the ACA only applies to America or the United States and applies nowhere else.
That makes sense. I mean, every country can pass their own laws, obviously. And so so after your claim is denied, you get back to the US. As I understand, you got reimbursed for part of the expenses. Is that right?
Yes, yes. Okay. Now, while I was in Thailand, what I found out is that the Thai government has the healthcare fund. So if it's an emergency and you go to the emergency room, the Thai government will cover the majority of the cost or whatever you can pay. So I paid out $10,000 out of my pocket, but the Thai government, they covered the rest of the cost. So that was good. So when I got back to America, I'm on Medicare. And every year you have to go through, I'm on Medicare Advantage. And every year you have to go through, I guess, pick your Medicare Advantage plan because every year they always change. So I was always told that, Medicare does not cover any healthcare costs overseas. But I had a new agent and she told me that they do cover costs overseas under certain requirements. So I got a little lucky that way. So she told me what the requirements were, and she told me I had to fill out a claim, and I did. And after I filled out the claim and I got all my documents together and I mailed it to them, I got a check completely reimbursed 30 days later. So what happens is you go overseas, any country, Medicare will not pay them directly. You have to get a bill directly from the hospital. And it has to be for an emergency. And you cannot be out of the country for more than 60 days. So when I got back, I gave them a copy of my plane ticket and a copy of the medical bill and told them what it was for. And the claim form is like 1 or 3 pages. And you just tell them where the hospital were, a copy of the medical bill, that you went to the emergency room, that you had a heart attack. And I sent them a copy of my plane ticket on my return trip. And 30 days later, they sent me a check. And that's all. And that law is in for regular Medicaid, for the Medicaid Advantage plans, and also for the Medicaid supplement plans. They all have in there a clause that will reimburse you if it's for an emergency and you're overseas and you need emergency treatment. Right.
With a 60-day limit, though. So if it had happened on the 61st day, you wouldn't have been covered?
Probably not. So it was in the 60 days. But they never asked me for any proof that I was gone for more than 60 days.
So is the idea behind it that that once you're in the hospital and you're being treated, the insurance company can go back and just check your history or whatever and see if you've had anything, and then they look for loopholes to get out of paying? Is that kind of what could happen?
Well, the lady I talked to at the insurance agent was very nice. And I don't think she was looking for loopholes. I think she was just trying to follow the rules.
Okay.
But when you apply for insurance or health insurance, I send her all of my medical records. all the ones that I had. And I had them at least my last year worth of medical records. I may have sent them other years too, but I know I sent them my last year of medical records. And the last year I went to all my doctors and they cleared me and they said I was in good health. So I wasn't worried about it. So when I filed my claim, she asked me to fill out a form so she could go back and get my medical records from all my doctors. So they get the medical records and they look over your medical records for the past 5 years. And that's when they follow their rules to see if they can deny you.
But maybe another way is to pull 5 years of your medical records and give that to the agent, and then would they deny you, do you know, or do they increase, or what happens then?
When I first got the insurance, I think I only gave them 1 year of medical records. And then when I had to file a claim, I had to fill out a form. And then when it got back to 5 years, they don't really ask for the 5 years until they have to dish out the money. And they probably won't take a look at it either, even if you give them the 5 years. But also, this is a very important part. So if you ever get any type of international coverage, I always ask if I want to go on for 3 or 4 months and decided to end my trip, can I, cancel the policy? I found out the policy I had that I could not cancel whatsoever. I still had to pay for the whole 1 year, which was about $200 a month. But I found out later I was able to fill out some forms and tell them I was coming back to the United States permanently and I was not going back overseas. And since I was on Medicare, then I was able to cancel it. So if you're not on Medicare or some other government health insurance policy, I always check to see if you can cancel the policy. And I didn't really read my policy. I didn't read my policy, and I should have sat down and read it and did follow up.
I remember the day when everyone was denied coverage, and then they would maybe as a rule, like as Americans, we sort of think we're protected now under Obamacare, but that doesn't seem to be the case. So.
Well, I didn't think I was protected up under Obamacare. I thought I had good international health insurance.
Right. Okay.
I found out that it wasn't.
Yeah.
And I didn't realize that I probably didn't really completely need it because I had Medicare. I'm on Medicare.
So I have kind of an odd question for you. I get once in a while from people, and maybe you have some insight. But some people say, why would I want senior care? I'm moving overseas. I'm gonna get insurance overseas. I won't be coming back maybe every other year to see family. I'm not gonna get. What are your thoughts? Is that a smart move if you're really moving overseas for good and you're not, you only plan to visit the US? What are your thoughts about that?
Well, I'm not sure. I don't know anything about senior care.
Well, I just mean Medicare.
Okay, well, when you got Medicare, you have to pay for Medicare Part D, and that pays for hospitalization and your drug costs. You have to get that, which costs about $200 a month. And if you don't get it and get later on, you get penalized. So a lot of people will get regular Medicare, that's for everyone. Then they'll get a Medicare Advantage plan or Medicare Supplement plan. And it also depends on your income. My aunt she's in her early 80s, and she has a Medicare Advantage plan, the same one I have, but she doesn't get nowhere near as many benefits because her income is a lot higher than mine. And then you have other Medicare Advantage plans, and some of them are very good, and some of them suck. So when it comes, and there's hundreds of them. So when you get on Medicare here in the United States, you have to go through a whole bunch of Medicare Advantage plans. Then you have something called Medicare Supplement plans, which is cheaper. They don't cover as much, but they do help if you have a lot of medical bills. So let's take my aunt, for example. She has both Medicare Advantage, and a Medicare Supplement plan. And the Medicare Supplement plan pays for her co-pays and her deductible because she has a lot of health problems, and her deductible is like $5,000 a year. And then after she pays that, then they start kicking in to pay for her medications and everything else. But her supplement plan kicks in and helps pay for her deductible. Now, since my income is a lot lower, I don't have to worry about that. I don't have nowhere near as high of a deductible. But like I said earlier, those plans, all three of them, regular, the Advantage plan, and the supplements, will cover you if you're overseas. But you only can be gone for 60 days. Thailand, I have to admit, had better health care than when I got here. The doctors and the nurses, they really pay attention and they really listen. Where the doctors here, they don't really pay attention, they don't listen nowhere near as well as they did in Thailand. But if you do shop for any international health insurance, don't just rely on the agent. Also call up the insurance company directly and also talk to them.
Great advice. Great advice. And the other advice I've heard from people that are retired in Thailand is that you can buy local Thai insurance if you're in Thailand, and it's much cheaper than international policies because you're just in that one country.
I thought I know I looked into that too before I left. I got the Thai long-term retirement visa,
Uh-huh.
and I was going to get the local insurance, which is about the same price, about $200 a month. But when I went to the website, the Thai embassy website, you had to pay for the whole year up front. And I couldn't find any insurance on there that worked for any other country other than Thailand. So, I mean, there might be something on there, but the ones I looked at only worked for Thailand. So I wanted to go to Vietnam, I wanted to go to the Philippines. My insurance that I got from Thailand directly wouldn't have covered me. That's the only reason why I did not get the Thai insurance.
So if someone's thinking of moving overseas and they're interviewing, if you will, insurance agents, what should they do, to reduce the chances that they'll get denied coverage by their international insurance company? What are your thoughts about that?
Well, I'm not sure what to tell them. I would say get safety wing. Everyone has that. Everyone overseas knows about that insurance company. It's out of Texas, and it seems to have a very good reputation. Now, I never used it, but from talking to other people, if I go overseas again, that's the one I'm going to look more deeply into. But other than that, I really can't give them too much advice because I talked to my agent, and I guess if I read the fine print a little bit more, or if I called up the insurance company directly and talked to them to see about pre-existing conditions, to see how all that is related. But at the same time, there was a lot of information I didn't know because it was the first time I ever had any international health insurance. So I didn't really know what questions to ask, even if I did call up to the insurance company directly. I didn't realize that until I filed my claim that everything is related, that if you have diabetes, they could deny you if you have a heart attack because the diabetes is related to a heart condition. Different forms of cancer can be related to diabetes or even a heart condition. Different medications that you're on can cause diabetes because it can cause weight gain, like different steroids, and that can also deny you coverage. Pretty much what I think is the only type of coverage I would have had is if I got into a car accident or I fell off a cliff and broke my leg. But anything other than that, unless I was like in my 20s, I wouldn't have really been covered just because I had some type of pre-existing condition.
And it's delightful. Thanks for coming on the channel, Todd, and sharing your story. I really appreciate it.
I thank you, Dan.
Here are my takeaways. With respect to international health insurance or foreign national health insurance, I would go into detail with the agent or whoever's representing that health insurance and find out what their conditions are with respect to pre-existing conditions. And I would go over that in great detail. Then I would ask, can I cancel this policy when it issues? How many days do I have to get a cancellation if the policy doesn't correspond to what my understanding is of the policy? And I would cancel the policy if it did not correspond to my understanding. And that would be true for both international and foreign. I would also be interested in whether or not, when I arrive at the hospital, if it's international, is this something I give the card to the hospital, or do I have to pay for the services and then the insurance company will reimburse me? That's important, because if you don't have the resources to pay for the insurance in advance, it may not help you to have insurance. And with respect to Medicare, I would verify that the policy you're looking at actually has that 60-day language in it where you can, for emergencies. Now remember, this is for emergencies. You have to go to a hospital on an emergency. I would verify that it had that language and that the 60-day period was in your policy, and that would only apply in that case. And finally, with respect to Todd's recommendation of Safety Wing, last time I checked, and things change, it was quite expensive for people, say over the age of 39, more than many international policies are. And it had many pre-existing exclusions also. So look into that carefully before you just assume it's just as Todd recommended, before you assume it's a better situation. And also, with respect to any policy that once you receive the policy, after you've confirmed that you can cancel it, read it. Make sure that the pre-existing conditions actually comply with what you understood the policy to be. And finally, if the policy is so complex that you're unable to read it, I would bring in a lawyer to have them explain it to you. It might be worth the cost of that in the event you have a major expense. One last thing I should mention, and that is that for most of the time over the last 18 years, the overwhelming majority of it, I was just pay as you go. If you have resources to even consider the idea that you're going to self-insure, think of that as one possibility for you, because I would have paid much more money in health insurance than I did in healthcare for most of actually all of I've never had a claim on health insurance since I first bought it 1.5 years, 2 years ago. So it depends on your health and your ability to pay, but it's something to at least think about. Those are my takeaways.